Hello, good evening. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to this evening's YouTube live open clinic. Today's broadcast is going to be very, very important for all women, but especially for women that are planning to become pregnant. So in our group, this special group of women are called Believing for Baby Mothers. Believing for baby and baby mothers. Okay, so thank you so much and quickly settle in. We're going to talk about the 5 important facts about prenatal multivitamins. Is there any way prenatal multivitamins can affect your fertility? As a woman, we're going to talk about the woman today. Then later, we're going to talk about the man. So what's the connection between prenatal multivitamins and fertility? Is there any way taking prenatal multivitamins can improve your fertility, both directly and indirectly? So in the next few minutes, we're going to have meaningful conversation. But please, when you come in, introduce yourself, tell me who you are. It's going to be an interactive session. So the first part of my presentation is going to be more about the facts. Then after that, I'm going to give you an opportunity to ask your questions. Please remember to click on the subscription button, click on the notification, then make sure you review previous videos. We have so many helpful videos that will impact you and make sure you're in the right direction. The aim of our group is to educate you so you can change your attitude, so your attitude can affect your practices, your perception. The overarching aim of our group is to help you to become pregnant, to help you to sustain your pregnancy, and also to help you have a very good outcome in your pregnancy. So let's start. So today we're talking about prenatal multivitamins, and there are important 5 points I want you to take home today. Number 1, it's highly recommended for all Believing for Baby mothers. So you see, the unique thing about our group is the fact that we don't try, we believe. So there's a big difference between believing and trying. So we call this special group of women BFB. They are women that will become mothers in upcoming year. It takes 9 months to achieve this. So your prenatal multivitamin is actually the only allowable drug you can take in pregnancy without prescription. Though some women might have a need for prescription prenatal multivitamins, but generally across the border, it's important you take prenatal multivitamins. So why is it multivitamin? Because there are so many vitamins in the body, which is helpful to make sure you get adequate components when you're planning for a baby. So it's helpful in helping in healthy pregnancy, especially the folic acid component. It's advised you take it before and during pregnancy, the whole period of pregnancy. The folic acid component actually helps in reducing a defect in your developing baby in a special place called the neural tubes. The neural tubes are the special place that the spinal cord and the brain of the baby develop. So when you have adequate component of folic acid, which is part of the prenatal multivitamins, your baby will have an opportunity of developing better. Now, the number 2 point, which you should bear in mind, it's actually important that your prenatal multivitamin is fortified. So by fortification, I mean there are components that must be there. Number 1, folic acid. Your folic acid should be between 400 to 600 micrograms, especially for women that are planning to. Now, when you eventually become pregnant, your provider might tend to increase it a little bit, but generally across the board, for all women who are going to become mothers in the upcoming year, please pop your prenatal multivitamins. Make sure the folic acid component is between 400 to 600 micrograms. Take it completely. Now, besides the folic acid, your prenatal multivitamin should also contain vitamin E, vitamin D, the omega-3 fatty acids, and a couple of other important components like selenium, fish oil. These are the components that will help you and your baby to develop properly. Now, number 3 point is actually an evolving concept. So lately, for so many studies, it appears that when you take prenatal multivitamins, indirectly it helps in improving the fertility outcome in women. So there have been so many studies out there. When you go for studies, you give a particular people one thing and you don't give a particular people another the same thing, then you can compare. So in all these studies, we discovered that women that had prenatal multivitamins, when the end of the study came, they had a better indices. They had a better fertility outcome. So this is based on increasing the fertility rate. So women that were taking prenatal multivitamins had increased fertility rate. So there is so many good reasons to supplement with your prenatal multivitamins if you are planning to be a mother. Now, here's the deal. Because no one knows the exact time they are going to become pregnant. So if you are currently making love with your partner without protection, you can become pregnant. So by wisdom and by convention, if you are currently sexually active without protection, it's advised you pop your prenatal multivitamins. Now, number 4 point, which is very important. When do you need to start taking your prenatal multivitamins if you're planning to become pregnant? At least 3 months before pregnancy and throughout pregnancy. Now, I know some women are not good in taking drugs. So there are important periods you must take it. 6-month period, 3 months before pregnancy and 3 months into pregnancy. Remembering that pregnancy is divided into first trimester and second trimester, then third trimester. So within that 6-month period, it's when you need to have adequate components, especially the folic acid. Why? This is when the brain of the baby is actually developing. So by the time you're going into your second trimester, the brain of the baby would have been fully developed. Now, all women, the last point, all women in reproductive age bracket are actually advised to start taking prenatal multivitamin. You should start as little as 400 micrograms of folic acid daily. However, like I mentioned, when you are pregnant, your doctor can evaluate and see if they can up or give you prescription prenatal multivitamins. But you don't necessarily need prescription to get it. It's over the counter. If you're in Nigeria, the popular one there is Pregnacare. Now, there are a couple of important components of the prenatal multivitamins I'm going to mention in the passage. Number 1, fish oil. Your fish oil contains omega-3 fatty acids. Omega-3 fatty acid actually helps in improving the female fertility, especially the egg component. Now, the next component of your prenatal multivitamin, which is very important, is actually an enzyme we call coenzyme Q10. CoQ10. So if you've gone for IVF, you will understand and you will notice that most IVF providers will give you CoQ10. Why do we believe in CoQ10 if you're going for fertility treatment? Because we believe that CoQ10 can actually help in optimizing the air quality and also the lining of the uterus. So CoQ10 is also important. Then lastly, selenium. Selenium is actually called a supervitamin for pregnancy and fertility. It also has some antioxidant powers. So oxidants are things that damage the cell. So selenium, fish oil, CoQ10, vitamin D, and vitamin E. So bottom line, anytime you have the intentions of becoming a mother, it's something that should be planned. So you have to go for pre-pregnancy counseling. You have to start living healthy. The reason why we're even taking prenatal multivitamin is because we don't get enough from food. If we are eating properly, you don't even need your prenatal multivitamins. But because we don't eat the right things, we are supplementing. So most of the components in your prenatal multivitamins, like your folic acid, there are so many food condiments, there are so many food items that contain folic acid. If you're eating them in the right quantity, you don't need to take any extra. But because you're not eating them in the right quantity and we don't want to take chances, we insist that all women who are making love without protection, who are willing to keep their babies, because guess what? This is not the era of going for abortion. I hope you understand that. So if you're old enough to make love without protection, when you test positive, you should actually go for Thanksgiving. This is not the era of abortion. This is not the era of, being silly or being careless. If pregnancy comes out from your lovemaking, keep your babies. Okay, so that's in a nutshell my presentation this evening. I'm going to give us an opportunity to ask questions. So thank you for coming. Feel free to ask your questions in real time. So these are the 5 important points you need to know about your prenatal multivitamin. So indirectly, it can improve your ability to become pregnant, especially if you are above 35. So it has an indirect improvement in fertility, though not directly. So whether you take it, whether you don't take it, we are more interested in avoiding the neural tube disorders. So please go ahead and ask your questions so I can give you my feedbacks. So thank you so much. It's time for quick question and answer, and I'm going to give you feedbacks. Okay? So Ebenezer, you can go ahead and ask your questions, and I'll provide you feedbacks. And also, if you have any questions about my presentation, please feel free and ask. Remember to subscribe before you leave today. Subscribe to the channel. Tell other people about the channel. If you have someone that is having problems becoming a mother, becoming a father, we are here to help. I can help you to become, because becoming is what God made you to be. So long as you have this is a testament. This is a reminder you're a mother. So this is the reason why we gather every day. This is my biggest friend. So everything about the female reproductive system is something we need to be conversant with. So all our topics are derived from the female reproductive system. Okay, I have one question. Okay, please, Doc, what should women avoid when taking prenatal multivitamins? This guy is very smart. So here's the deal. By default, you know that when you're planning to become pregnant, you need to start living healthy, right? So definitely alcohol, you should avoid alcohol by all standards. You don't need your alcohol, okay? So you can take your prenatal multivitamins with water. Water is your best friend. You can take it with beverages, you can take it with, with soda. But personally, embrace your water. Water is your best friend. So if you are taking prenatal multivitamins, it's completely a must for all women. I have some women that say, oh, Doc, if you have fibroid, are you supposed to be taking your folic acid? It doesn't matter. If your fibroid is extensive, if the location of your fibroid is worrisome, if you're having symptoms and it's giving you a lot of troubles and it's inside your womb, you go and remove it. So it doesn't matter your condition. You have to take your prenatal multivitamins. The disadvantages of not taking your prenatal multivitamin, it's unimaginable. One of the things that will freak you out, imagine having your baby born and the back is completely open. There's a particular medical condition we call spinal bifida. So by simply taking your prenatal multivitamins, you are actually safeguarding your baby. You are more of ensuring that your baby will be okay, simply by taking it. So you do not have any excuse. This is why we have different formulations. So if you're good in taking tablets, if it's gummy, if it's liquid, whatever it is, take it exactly the way you need to take it. And because, lately, modern technologies are looking for opportunities to make life easy for people. There are some multivitamins that if you're taking it, you will think you're taking candy. You think you're taking chocolate. Like in my home, nobody wants to take capsule. From my wife to Zara to Dumeje, they all love the gummies. And I also love my gummies. Multivitamin is generally recommended for the whole family. But for women, make sure it's 400 to 600 micrograms. Okay? Awesome. Thank you so much, babe. Please, could you recommend the best prenatal vitamin to take for someone in the UK? So here's the deal. When you mention best, it will sound like, oh, if you don't take this, then this is going to happen. They are all the same thing. What you need to be on the lookout is the expiration date and the contents. So if you're in UK, actually, you can go for Pregnant Care. Vital Biotics, the company that makes Pregnant Care, I think has a headquarters in UK. So if you're in UK, be on lookout for Pregnant Care. Pregnant Care is very good. If you're in Nigeria, Pregnant Care is very good. Now, if you're in America, if you're in Canada, if you're in Australia and other places, if you go to any good pharmaceutical shop, there are thousands you can buy, but make sure it's fortified. So look out for folic acid, look out for selenium, look out for vitamin E, look out for omega-3 and other important, matter of fact, all the vitamins, but the ones I mentioned are the key ones you have to look out for. And when you are buying, make sure it has adequate content. It's very important. Start taking it immediately because you don't know when you're going to get pregnant. So you don't want to be caught off guard, okay? Very good question. So do we have any other question? Correct. Thank you so much. So if you have any other question, please ask before I wrap up. Now, when you understand better, there are little things which matter. Are there any side effects? Completely none. And I can tell you for sure. Now, in medical practice, for anything you're taking inside your body, you might have some side effects or adverse effects. But guess what? The way they formulated prenatal multivitamin, if you're taking it, it will be more like you're just eating something sweet. So it's helpful. The only thing is people tolerate things differently. So some people might not be good in taking capsules. Then in that regards, you can switch to gummy or you can go for liquid. And some women, when they eventually become pregnant, they might be prone to having what we call hyperemesis gravidarum. So you notice that you have this urge to vomit, and some women can actually vomit frequently. The problem with vomiting frequently in pregnancy is dehydration. But for whatever reason, I can't think of any side effect of taking your prenatal multivitamins. Very important questions I'm getting this evening. So thank you so much. If you have any other further question, please ask. Tomorrow we're going to find another topic. And please, if you're in our Facebook, make sure you join our group. Make sure you join our page. If you're in Instagram, join us. Every single day you will learn something new. Now, please, before you go today, make sure you click on the subscription button. Make sure you also click on the notification so that anytime I come live, by default, you'll be notified I'm live, okay? Thank you so much. Should women with multiple pregnancy take prenatal multivitamin? You see, the way this young man is going, I doubt if he's going to escape being a doctor. He's an engineer, he's a computer engineer, but he's so smart. Now, here's the deal. By default, all pregnant women will have a need for prenatal multivitamin. Now, when you're carrying more than one baby, you might actually have a need to have an increased dose. So pregnant women that are expecting more than one baby can actually have higher. So instead of going for 600 micrograms, we can increase it to 1 milligram. So multiple pregnancy is an abnormal form of pregnancy. I know some people don't understand this. Multiple pregnancy, your womb is structured to contain only one baby. So when you're having more than two babies, it's actually an abnormality, but it's a good abnormality. So here's the deal. If you are expecting twins, your doctor by default will give you prescription multivitamin. So prior to your pregnancy, you can feel free to be taking the normal pregnant care, the normal multivitamins. Then once you become pregnant, when you go for your ANC, the likelihood that your provider will give you fortified prescription-only multivitamin is high. Multiple pregnancy is a high-risk pregnancy, especially if you're above 35. So we want to make sure that you and your baby are in good place. Very smart, very important question. Thank you so much, Ebenezer. Babe, do you have any question? You can go ahead and ask. I remember before you had Zara and Dumeje, you popped a lot of them, though you were not too good in taking your drugs. So if you have any questions, you can feel free to ask before I wrap up. Okay? Ebenezer, quickly, can you tell us the topic we have tomorrow? Can you peep in and tell us the topic we have tomorrow so other people can also be preparing for tomorrow? Okay? Oh, thank you. You're welcome. So thank you so much. Remember, prenatal multivitamin helps indirectly in giving you a better outcome, in giving you a better, expectation in your fertility, okay? Especially if you're older. So it's advised you start taking it if you're making love without protection. Okay? All right. So at this juncture, I'm going to take my leave. I hope to see you tomorrow. Until I see you, keep on living healthy. Remember the 3 components of the group. Pray to God every waking up. Play 48 hourly. Play means make love regularly. The more you make love, the more you're increasing your chance of becoming pregnant. Then when you've prayed, and you played, practice. So virtually everything I teach you guys every day, put them into practice, and by the grace of God, you become a mother soon. Bye-bye for now.